Welcome back to Whole Health, the place where wellness meets wisdom. Today, we're diving into an exciting topic: 7 signs of a damaging liver. Many people unknowingly experience a gradual decline in liver function, where cells become fatty, inflamed, and scarred. This progression eventually damages the liver. But what's behind it? The answer might shock you and even frustrate you. We'll explore 7 early signs of liver damage that are often overlooked but crucial to identify. The tricky part with liver issues is that symptoms don't usually show up until the damage is significant, sometimes with up to 90% of the liver already impaired. I have personal experience with this, having dealt with liver damage in my 20s, so I want to share what I have learned. Before we dive into the symptoms, please don't forget to like, comment, and subscribe to the channel. Early warning signs of liver damage. Number 1. Spider veins or red dots on the skin. The appearance of spider veins or telangiectasis disease or tiny red dots or petechiae on the skin can be an early sign of liver function. These vascular changes are more than cosmetic. They signal hormonal imbalance and circulation issues tied to liver health. Spider veins are small dilated blood vessels that appear near the surface of the skin. They often resemble a spider web or sunburst pattern and are commonly found on the face, chest, or legs. Red dots result from small capillaries bursting due to weakened vessel walls, a side effect of poor blood flow and hormonal changes. These are typically seen in areas with thinner skin. The liver plays a crucial role in regulating hormones, including estrogen. When the liver is damaged or its function impaired, it struggles to process and eliminate excess hormones from the bloodstream. This leads to an estrogen buildup, which can affect blood vessels and skin appearance. The effects of estrogen dominance due to liver dysfunction can manifest differently based on gender. In men, high estrogen levels can lead to development of excess breast tissue. Estrogen dominance can inhibit androgen levels, leading to reduced body hair, especially on lower legs. The skin may lose its firmness and develop a smoother, almost glossy appearance. As testosterone levels decline relative to estrogen, men may notice changes in muscle mass, voice, and overall physical appearance. In women, this can include irregular menstrual cycle, PMS, or an increased risk of estrogen-driven conditions such as fibroids or endometriosis. Prolonged estrogen dominance without proper elimination by the liver can increase the risk of breast or uterine cancer. If left unchecked, estrogen buildup and liver dysfunction can lead to complications such as increased risk of cardiovascular diseases due to damaged blood vessels, hormonal imbalances contributing to metabolic disorders, or further liver damage. To address this issue, reduce consumption of processed foods, alcohol, and high-sugar diets. Focus on liver-friendly foods like leafy greens, cruciferous vegetables, and healthy fats like omega-3s. Reduce exposure to xenoestrogens like plastics, pesticides, and cosmetics with synthetic hormones. Maintain a healthy weight. A fat tissue also produces estrogen. Blood tests can measure liver enzymes, bilirubin levels, and hormonal imbalances. Imaging studies may be necessary to rule out significant liver damage or other conditions. Regular physical activity improves circulation and supports hormonal health. Stay hydrated to promote bile flow and toxin elimination. Spider veins and red dots are not just surface-level concerns. They are outward signs of deeper hormonal and liver-related issues that, if addressed early, can prevent further complications and restore overall health. Number 2. Darker, old-smelling urine. The color or odor of urine can provide valuable clues about your liver's health. When the liver isn't functioning properly, it can disrupt the processing and excretion of bile, a digestive fluid critical for fat metabolism. This dysfunction may result in darker, foul-smelling urine, often accompanied by other symptoms of liver distress. Urine from a compromised liver often develops a distinctive smell, described as foul or musty. This results from the buildup of waste products like ammonia or sulfur-containing compounds. This odor arises because the liver is less able to filter toxins effectively, causing unusual byproducts to enter the urine. Dark urine is not always due to liver problems. It can also result from certain foods like beets, rhubarb or certain vitamins, or medications like antibiotics, laxatives, or supplements like B-complex vitamins. However, if dark urine is accompanied by symptoms like jaundice, yellowing skin or eyes, pale or clay-colored stools, fatigue, nausea, or abdominal discomfort, unexplained itching or swelling, then liver issues must be looked into. To address dark urine from liver problems, ensure adequate water intake to flush out waste products and prevent concentration of urine. Increase intake of antioxidant-rich foods like leafy greens, turmeric, and garlic. Avoid alcohol, processed foods, and high-sugar items. If dark urine is due to a specific condition like hepatitis or gallstones, targeted treatments like antiviral drugs, bile duct surgery, or lifestyle changes may be necessary. Dark, unusual-smelling urine is a red flag for potential liver dysfunction, often indicating problems with bile processing or toxic filtration. If persistent, especially alongside other liver-related symptoms, it's crucial to seek medical attention promptly to address the root cause. Early intervention can prevent further liver damage and restore overall health. Number 3. Fatigue and loss of endurance. One of the most common early signs of liver damage is fatigue and a noticeable decline in physical endurance. This is just about feeling tired after a long day. It's a deeper, more systemic issue tied to the liver's central role in metabolism and energy regulation. The liver is responsible for metabolizing nutrients from food to produce energy. It is also a quick-access form of glucose used for energy during exertion. It prevents the buildup of harmful substances that can sap energy. When the liver is damaged, its ability to perform these functions diminishes, leading to persistent fatigue and reduces stamina. People with liver issues often feel tired even after a full night's sleep. Their energy can wane quickly, leaving them needing rest after minimal activity. Activities like climbing stairs, walking long distances, or exercising become more challenging. Some may feel short of breath or unusually drained after minor exertion. Over time, the fatigue can progress into physical weakness, making simple tasks like standing up from a chair or getting up from the floor more difficult. Number 4. Itchy skin, especially feet or hands. Persistent itching, particularly in hands or feet, can be an early and frustrating sign of liver damage. While it might not seem immediately related to the liver, this symptom has a specific and concerning underlying cause tied to the organ's inability to process bile efficiently. The liver produces a bile, a fluid that helps digest fats and eliminate waste products, including bilirubin and bile salts. When the liver is damaged, bile can back up into the bloodstream instead of flowing properly through the bile ducts into the digestive system. This results in an accumulation of bile salts in the blood and tissues, which triggers itching and condition known as cholestatic pruritus. The sensation may range from mild irritation to intense, unbearable itching. It often feels deep under the skin, making scratching ineffective and causing frustration. Scratching can lead to skin damage, redness, and, in some cases, secondary infections. If itching is related to liver issues, it's often accompanied by other symptoms like jaundice. Itchy skin can signal the liver is struggling to function properly. If itching is persistent, unexplained, and accompanied by other liver-related symptoms, it's essential to consult a healthcare professional. Blood tests like liver function tests and imaging may be required to evaluate liver health and bile flow. While addressing the root cause, liver health is critical. Here are some ways to relieve the itching in the short term. Moisturize. Use non-fragrant hydrating creams to soothe the skin. Maintain healthy bile flow. Consuming liver-supportive foods like bitter greens and turmeric may help. A balanced diet low in sugar, starches, and processed foods. Weight management to reduce the burden on the liver. Avoiding alcohol and other liver toxins. Itchy skin, while seemingly minor, can be a significant warning signal of underlying liver dysfunction. Early recognition and intervention can prevent further complications and improve overall quality of life. Before we continue, please press the subscribe button for more informative videos like this. Number 5. Feeling of fullness or pain under the right rib cage. Pain or a feeling of fullness under the right rib cage is a common but often misunderstood symptom of liver problems. This discomfort stems from the liver's enlargement or hepatomegaly due to inflation, fatty deposits, or scarring. As the liver swells, it presses against the capsule surrounding it, which is rich in nerve endings causing pain. The liver's irritation can stimulate the phrenic nerve, which originates in the neck and runs through the diaphragm. This nerve connection can cause referred pain in the right shoulder. The tension can also radiate along nerve pathways, especially near scapula, shoulder blade, and sometimes down the right arm. This can be misinterpreted as a musculoskeletal issue. The liver and gallbladder are closely related anatomically and functionally. The liver becomes inflamed. It can compress the bile ducts or irritate the gallbladder. This often leads to confusion, as gallbladder pain also presents under the right rib cage. Liver-related pain is more diffuse, persistent, and associated with liver inflammation or swelling rather than food intake. Some people describe the sensation as a band-like tightness around the right upper abdomen. The phrenic nerve can also cause pain in the neck or worsen existing tension in the upper body. If the liver's condition progresses without treatment, this symptom can persist or worsen, affecting posture and mobility. Number 6. Thyroid dysfunction. The liver is deeply involved in thyroid hormone metabolism, and liver dysfunction can significantly affect thyroid function, leading to symptoms that mimic or worsen hypothyroidism. Understanding this connection is vital for identifying and addressing thyroid-related symptoms effectively. Thyroid hormones regulate metabolism and energy levels, with thyroxine or T4 and triiodothyronine or T3 being the primary hormones produced by the thyroid gland. However, most of the active hormone, T3, is not directly made by the thyroid but is converted from T4 in peripheral tissues, primarily in the liver. How liver damage affects the thyroid. When the liver is damaged, its ability to produce deogenesis decreases, leading to lower levels of active T3 and an accumulation of inactive T4. Liver dysfunction often leads to a buildup of estrogen in the body. Excess estrogen can increase the production of TBG, which binds more thyroid hormone and makes less of it available for cellular use, further contributing to hypothyroid symptoms. Chronic liver damage causes systemic inflammation, which can interfere with thyroid function and hormone signaling. The liver is responsible for detoxifying the body. When it becomes compromised, toxins accumulate, stressing the thyroid and further disrupting its function. Steps to address thyroid dysfunction caused by a liver damage. Reduced sugar in processed foods. Minimize liver stress by avoiding high fructose corn syrup and trans fat. Incorporate cruciferous vegetables like broccoli and kale, garlic, turmeric, and healthy fats like olive oil. They are liver-friendly foods. Stay hydrated. Proper hydration helps flush toxins and supports bile production. Ensure sufficient iodine levels, like seaweed and iodized salt. Work with your healthcare provider to determine if temporary thyroid hormone replacement is necessary. Thyroid dysfunction caused by liver damage often develops subtly, but can significantly impact overall health. By addressing liver health, many thyroid symptoms can be alleviated, restoring energy, metabolism, and vitality. The liver-thyroid connection emphasizes the need for a holistic approach to treating both organs and long-term wellness. Number 7. Vitamin D deficiency. Vitamin D, often referred to as the sunshine vitamin, is vital for various bodily functions, including bone health, immune regulation, and inflammation control. While sunlight and diet provide vitamin D, the liver plays an indispensable role in converting it into a usable form. When liver function is compromised, vitamin D levels can plummet, leading to a cascade of health issues. The skin produces vitamin D3 or cholecalciferol when exposed to UVB rays. Foods like fatty fish, egg yolks, and fortified products can also supply vitamin D. Once absorbed or synthesized, vitamin D travels to the liver when it undergoes its first transformation into 25-hydroxyvitamin D or 25-OHD. This form, also called calcidiol, is what doctors measure in blood tests to assess vitamin D levels. When liver function is impaired, it prevents the activation of vitamin D and leaves the body deficient despite adequate intake or sun exposure. When there is vitamin D deficiency, there would be inflammation, often manifesting as pain in the lower back, joints, or muscles, muscle cramps, spasms, and knots, particularly in the back and legs. Individuals will be more susceptible to infections, delayed wound healing, and chronic illnesses. Patients may experience bone tenderness or an increased risk of fractures, chronic fatigue, and reduced energy, compounding the fatigue already caused by liver dysfunction. When liver damage occurs, even large doses of vitamin D supplements may fail to correct deficiency because the liver cannot convert vitamin D properly. Because without the liver's enzymatic processes, vitamin D remains inactive. The liver serves as a reservoir for fat-soluble vitamins like D, and damage reduces its ability to restore and release them. To address vitamin D deficiency with liver dysfunction, eat foods rich in antioxidants like leafy greens, berries, and cruciferous vegetables. Reduce alcohol, processed foods, and trans fats. Use supplements like to support liver detoxification. Spend 15 to 30 minutes in sunlight daily, exposing large areas of the skin. Choose high-quality vitamin D3 supplements with keto, which helps direct calcium to the bones. Monitor blood levels. Consult your healthcare provider to address both liver health and vitamin D supplementation strategy. Vitamin D deficiency in the context of liver damage is not just a vitamin issue, but a systemic one. Treating the liver alongside strategic supplementation is the best approach to reversing deficiency and mitigating its health effects. Restoring vitamin D levels can help reduce inflammation, strengthen immunity, and improve overall vitality. To combat liver damage and improve overall health, the solution lies in dietary transformation. Cut out sugar, refined starches, and processed seed oils. Avoid processed foods and sugary beverages. Adopt liver-friendly foods. Whole, nutrient-dense options like leafy greens, healthy fats, avocados, nuts, and olive oil, and lean proteins. Focus on anti-inflammatory choices to reduce liver strains. Understanding what harms your liver is the first step. Now, it's time to focus on what nourishes and protects it. To explore practical tips and actionable steps for creating a liver-friendly diet, check out other videos in our channel. Your health begins with the choices you make, starting with what's on your plate. I hope you have gained one or two things from this video. Please comment on what you have gained. Share the video and don't forget to press the subscribe button. Thanks for watching.